senator from Texas has touched on a very important issue, and the motion that she offers, in which I co-sponsor, does lay out what I think is a simple principle of fairness that most Americans understand, and that is that when you implement public policy, if you're going to raise taxes on people, you ought to align the tax increases and the benefits so they start at essentially the same time. And what this bill does, the underlying bill does, is it starts collecting taxes, increases taxes on Americans 4 years before the major benefit provisions kick in. So in January 1 of 2014, 99% of the spending under the bill kicks in, but the tax increases begin, I might add, less than 3 weeks from today. 16 days from now is when the tax increases in the bill start. The tax on prescription drugs, the tax on medical devices, the tax on health plans all begin 16 days from now. And so a lot of those taxes that are going to be imposed upon the American economy are going to be passed on to people, small businesses and individuals, in the form of higher premiums. So people are going to get higher premiums 4 years before they're likely to see any benefit from this. 99% of the spending under the bill doesn't kick in until January 1 of the year 2014, or 1,477 days from now. And I think that most Americans, as they listen to the debate, believe, as I do, as a simple principle of fairness, that you ought to align the benefits and the taxes in this. Now, we had a vote yesterday on the Crapo Amendment that would recommit all the tax increases. Many of us don't believe that raising taxes on small businesses when you've got an economy in recession is a smart thing to do. It's going to cost us a lot of jobs. Small businesses have made that very clear to us. But I also think that in addition to the principle of fairness that is at play here, when it comes to raising taxes 4 years prior to the benefits kicking in, you also need to have, I think, a transparent sort of understanding about what the costs of the bill are really going to be. Because one of the reasons that the revenue increases, the tax increases, were begun immediately or 16 days from now, but the majority of the spending, 99% of the spending, doesn't occur until January 1 of 2014 and beyond, is to understate the true cost of this. They want to bring the cost of the bill in under $1 trillion. And if you can see, starting this year and going through 2019, it ends up at about $1 trillion or $1.2 trillion on this chart. But if you look at the fully implemented period, and that is 2014, when the benefits and the spending in the bill really begin, and take that through the next 10 years, the total spending in the bill is $2.5 trillion over a 10-year period. And I think that's one thing, too, that the American people need to know, is that one of the reasons that this is being done, tax increases starting January 1 next year, 16 days from now, most of the benefits not starting until 1,477 days from now, is so that they can go out and say that this is only a $1 trillion bill, or under $1 trillion is what the way that's been advertised, when in fact it's going to cost $2.5 trillion when it's fully implemented. And so I would say to my colleague from Texas that, you know, we are here 16 days before Christmas, before the Christmas holiday, and there are things that Congress needs to do. There are a number of fairly urgent matters that need to be dealt with before the end of the year, some of which have been mentioned on the floor this morning. But trying to jam through a new health care program, $2.5 trillion expansion of the federal government here in Washington, 70 new government programs, and try and jam it through in the next 9 days or so before Christmas seems to be done more out of a political necessity, the need for a political accomplishment or a political victory, than it does to have anything to do with making good public policy. And so I would say to my colleagues that as our American people around this country are approaching this holiday season, the best thing that we could do, the best Christmas gift we could give the American people, frankly, is for Congress to adjourn and go home before passing this $2.5 trillion expansion. Because what does it mean? If you're a small business person, the Christmas gift you get this year is a big lump of coal from the American Congress in the form of higher taxes. If you are a senior citizen, one of the 11 million senior citizens who's on Medicare Advantage, and this bill passes, your Christmas gift this year is you're going to see benefit cuts. And the same thing applies to many of our providers, our hospitals, our nursing homes, our home health agencies, our hospices. If you are just an average American family who's worried about the high cost of health care, your Christmas gift this year is, if this thing passes, that your health insurance premiums are going to continue to go up year over year at twice the rate of inflation. You lock in higher premiums for most people across this country. You raise taxes on small businesses. You cut benefits to Medicare beneficiaries. And for future generations, you create a $2.5 trillion new entitlement program that they're going to be paying for as far as the eye can see. And I want to make one other point about that. The CMS actuary last week said, in addition to all the other things they mentioned, that the overall cost of health care is going to go up, 20% of hospitals are going to close, that the Medicare cuts that are being proposed cannot be sustained on a permanent basis. Well, if that's true, how is this going to be financed? Either with more taxes or borrowing it, putting it on the debt, and handing the bill to future generations. That's what we're left with, because once you lock in a $2.5 trillion expansion of the federal government, it is going to be very, very hard to reduce the cost of it. The spending is not going to go away, and the way it's going to be paid for, if the Medicare cuts are not sustainable, is the tax increases, and there are already increases in here, would have to be increased even further, or worse yet, for future generations, if you're a young American, you're going to get it put on your bill. So the senator from Texas and my colleagues who are here this morning, we all voted yesterday to get rid of the tax increases in the bill, but the motion that she offers and that I co-sponsor would at least as a principle of fairness, make sure that those tax increases don't begin before the benefits do. I would just say to my colleague from Texas that the taxes, the fees, the tax increases, everything in your motion, our motion very simply states that ought to be aligned with the beginning of the benefits. And the benefits, the exchanges, and frankly all the major policy, the substance of this bill begins in 2014. The individual mandate, the state exchanges, the subsidies, as I said, premium tax credits, Medicaid expansion, the employer mandate 2014, government plan 2014. The substance of this bill begins in 2014. Unfortunately, the tax increases begin 4 years earlier, 16 days from now. 16 days from now, January 1 of this year, is when the taxes start being raised. And of course, the CBO has said that those tax increases are going to be passed on in the form of higher premiums to people across this country. The benefits start 1,477 days from now. And so, Mr. President, what we would simply say in this motion is let's recommit this and bring it back out with the tax increases, if there are going to be tax increases, and many of us don't believe there should be, which is why we voted for the Crapo Amendment yesterday. But if you are going to raise taxes on American small businesses and families and individuals, at least align those so that they and the policy, the substance of this bill, which begins 4 years from now, are synchronized so that we are not slapping a huge new tax increase on American small businesses in the middle of a recession and passing on those higher costs, which is what they will do to people in this country in the form of higher insurance premiums. And so the senator from Texas, this is a very straightforward, simple motion. I hope that our colleagues on both sides will support it. It is a matter of principle of fairness when it comes to making policy, I think, that the American people have come to expect. And we ought to be honest and give the American people a complete understanding of what this bill really costs. Because they have done what they've done by instituting the tax increases immediately and the spending 4 years from now, it understates the overall cost of this legislation. The American people need to know that this is a $2.5 trillion bill when it's fully implemented, and the only reason that they can bring that in under that number is because they start raising taxes immediately and don't start paying benefits out for another 4 years. So I hope that Senator from Texas, when we get this vote, that it'll be a big bipartisan vote here in the United States Senate, and I hope that we will make a change in this legislation that implements some semblance of fairness and also gives us a true reflection of what this bill really costs.